You've been told your whole life get your checkups, stay on top of your health, but here's what nobody tells you. After 70, some of those checkups can hurt you more than help you, and the last one on this list. It has quietly sent thousands of seniors into a downward spiral they never recovered from. Stay with me, because this could be the most important health video you watch this year. I'm Dr. Sarah Mitchell, and I've spent over 25 years working with patients over the age of 60. I've seen what works, I've seen what doesn't, and I've seen well-meaning good doctors order tests that did far more harm than good in older patients. This channel exists for one reason: to give you the truth about aging that most doctors simply don't have time to explain in a 10-minute appointment. So let's get into it. Checkup number 1. Routine PSA screening for prostate cancer in men over 75. What it is: the PSA test measures a protein in the blood that can indicate prostate cancer. For decades, it was standard for men to get this test every year. Why seniors get it? Men over 70 are told you're at the highest risk, you need to screen. The hidden danger. Here's the problem. Most prostate cancers in men over 75 grow so slowly that they will never cause symptoms or death, but a positive PSA result. That triggers biopsies. Biopsies trigger surgeries, and those surgeries radiation, hormone therapy carry serious risks for older men: incontinence, impotence, cardiovascular stress, infections. A landmark study published in the New England Journal of Medicine followed thousands of men and found that aggressive treatment of low-risk prostate cancer in older men provided no survival benefit but caused significant harm. Real-life example. Harold, 77, had no symptoms. His PSA came back slightly elevated. 3 surgeries later, he was wearing adult diapers and battling depression. The cancer? It had never spread. His doctors admitted it likely never would have. What to do instead? Talk to your doctor about watchful waiting or active surveillance. The U.S. Preventive Services Task Force actually recommends against routine PSA screening for men 70 and older. Ask the question. Know your options. The next one surprises most people because it sounds completely harmless. Checkup number 2. Annual full-body CT scans. What it is: a full-body CT scan takes cross-sectional images of your entire body to look for abnormalities, tumors, blockages, anything unusual. Why seniors get it? It sounds like the ultimate peace of mind test. Scan everything, catch everything early. The hidden danger: a single full-body CT scan exposes you to the equivalent of 200 to 400 chest X-rays worth of radiation. At 70+, your cells are less capable of repairing DNA damage from that radiation, and the scans almost always find something: an incidental spot, a shadow, a small cyst that leads to more testing, more anxiety, and sometimes unnecessary invasive procedures. The American College of Radiology has clearly stated there is no proven benefit to full-body CT screening in asymptomatic patients and real documented harm. Real-life example. Margaret, 73, paid $1,200 out of pocket for a full-body scan at a private clinic. They found a small spot on her kidney. 6 months of follow-up scans, 1 biopsy, and enormous stress later, it was a benign cyst she had probably carried her whole life. What to do instead? Target your screenings. Colonoscopy if you have family history. Chest CT if you're a former heavy smoker. Not a blanket scan of everything. This is where most people make a mistake, thinking more testing always means better care. Checkup number 3. Aggressive cholesterol screening with automatic statin prescriptions. What it is: routine cholesterol panels are standard, but the danger isn't the test, it's what often automatically follows for seniors: statin medications, sometimes prescribed without proper context. The hidden danger: in patients over 75 with no prior heart disease, the evidence for statins preventing first-time heart attacks becomes significantly weaker. Meanwhile, the side effects become more pronounced in older bodies: muscle breakdown, myopathy, liver stress, memory issues, and dangerous falls due to muscle weakness. A major review published in JAMA Internal Medicine found that seniors over 75 without existing cardiovascular disease showed no clear mortality benefit from statin therapy but faced real medication side effects. What to do instead? If you're already on statins and have had a heart attack or stroke, do not stop. But if you're newly 70+ with high cholesterol and no heart history, have a real conversation with your doctor about whether the benefit outweighs the risk for your body specifically. Now we're getting to the dangerous ones. Number 4 catches people completely off guard. Checkup number 4. Routine annual Pap smears after 70. What it is? A Pap smear screens for cervical cancer. Women have been told for decades get one every year. The hidden danger. Most major health guidelines, including those from the American Cancer Society, recommend that women over 65 to 70 who have had adequate prior normal screenings should stop Pap smears entirely. Continuing past this point leads to false positives, and the treatment for those false positives in older women can cause significant cervical damage, bleeding, and anxiety with no actual cancer present. Real-life example. Dorothy, 71, received an abnormal result. She underwent a procedure to remove cervical tissue. Pathology came back benign. Her gynecologist later admitted the screening was no longer recommended for her age group. What to do instead? If you're over 65 and have had 3 consecutive normal Pap smears in the last 10 years, speak to your doctor about whether you can safely stop. This is a liberating conversation, not a frightening one. Checkup number 5, the one that could kill you. Carotid artery ultrasound screening in asymptomatic patients. What it is, this test uses ultrasound to look for plaque buildup in the arteries of your neck that supply blood to the brain. Why seniors get it? It's marketed heavily as a stroke prevention tool. Many wellness clinics offer it as a senior package add-on. It sounds responsible. The hidden danger and why this one is the most serious. Here's what the research shows. When asymptomatic seniors, people with no symptoms, screen positive for carotid artery narrowing, it triggers a surgical procedure called a carotid endarterectomy. Surgeons go in and clear the blockage. The problem? That surgery itself carries a 2-5 risk of causing a stroke or death in the operating room. For someone with no symptoms, you are trading a theoretical future risk for a very real, immediate surgical risk. The U.S. Preventive Services Task Force gives this screening a Grade D recommendation, meaning the harms outweigh the benefits in people without symptoms. Grade D, that's as clear as it gets, and yet clinics still offer it, seniors still pay for it, and some don't walk out of the operating room. What to do instead? Control the real stroke risk factors: blood pressure, blood sugar, smoking, physical activity. These interventions have proven, consistent, life-saving data behind them. Do not pay for screening that may send you toward a surgery you don't need. Action steps. Your checklist here is what I want you to do this week. Write down every screening or checkup you've had in the last 2 years. Ask your doctor, is this screening still recommended for my age group? Look up U.S. Preventive Services Task Force grades for any test you're unsure about. It's a free public resource. Never agree to an elective screening procedure without asking, what happens if this comes back positive? What are the next steps and what are the risks of those steps? Get a second opinion before any surgery that resulted from an incidental finding. Everything in this video is for educational purposes only. Do not stop any medication, cancel any appointment, or change any treatment plan without speaking directly to your physician. Every person's health history is different. This video gives you questions to ask, not answers to act on alone. If this video made you think twice about even one test, that's the goal. Drop a comment below. Which of these surprised you the most? I read every single one. Subscribe if you want straightforward, no-nonsense health information built specifically for people over 60. No fluff, no fear-mongering, just the truth. And in the next video, I'm covering 5 common medications that doctors are now saying seniors should reconsider. Number 3 is one of the most prescribed drugs in America. You'll want to see that one. I'll see you there. Stay well.